Hello, my name is Michael Cooperman, physical therapist. I am the CEO and founder of Sports Rehab Coach.com. Just to give you a little bit of background about myself, I'm a graduate of Columbia University School of Physical Therapy in New York City way back in 1972. I obtained my license in New York State in 1974. And I also was an owner, partner, and clinician in a private practice in New York City for 36 years. Tennis elbow is classified as an overuse injury. It occurs when there's twisting of the elbow over a repetitive number of times. This can happen in occupations such as an electrician, a plumber, or in the actual sport of playing tennis. The inflammation occurs along the prominent bone of the elbow, and a secondary symptom is tightness and inflammation of the extensor tendon that attaches to that prominent bone. The first exercise you should do for tennis elbow is a stretching of the forearm musculature. You would put your arm straight out, like so, put your thumb underneath your wrist, and push down on your wrist as far as you can go. You will feel a stretching sensation in the upper forearm. You would hold this for about 10 to 15 seconds and do these about 3 or 4 times a day. The first strengthening exercises for tennis elbow will focus on strengthening the elbow musculature. You would place a weight in your hand with your palm facing up. You flex your elbow slowly and you lower slowly into extension, avoiding to go into complete extension. So I'll repeat that again. You flex your elbow slowly and slowly bring it down without going into full extension. You can do these 10 or 15 times, 3 or 4 times a day. The second strengthening exercise for the elbow consists of having your palm facing your body, looking at this position like so, and you bring your arm just like you did the other exercise, but do not go into full extension. So you go into full flexion, and you go into a little bit of 10 to 15 degrees lacking of extension on this particular exercise. This you could also do a set of 10 or 15, and you can perform these very slowly. The third strengthening exercise is going to be focusing on the forearm musculature. So the proper way of doing this is to hold the weight with your arm or elbow at 90 degrees. You slowly turn your palm up and you slowly turn your palm down, always maintaining your arm parallel to the floor. You can do these 10 or 15 times, 3 or 4 times a day. The fourth strengthening exercise centers on the strengthening of the wrist. So you would hold your weight, just like I have it in this position. You bring your wrist up slowly, you bring your wrist down slowly. Notice that I'm supporting the forearm so it doesn't move. So you can do this exercise 3 or 4 times a day, and you can do it a set of 10. This concludes my video on demonstrating some simple stretching and strengthening exercises for the condition known as tennis elbow or lateral epicondylitis. I want to thank you for watching the video, and if you have any questions, you can email me at michael@sportsrehabcoach.com.